Dikit-dikit. 1 meter po. Yung mga nakapila lang po. Tasuyo. Huwag tayong magumpungan.
A village official has confirmed that the elderly man who lost consciousness while lining up for Angel Locsin's community pantry has died upon arrival at the hospital.
Actress and philanthropist Angel Locsin apologized after an elderly man who lined up at her community pantry in Quezon City passed out and eventually died. Locsin explained that the distribution started out orderly but things got out of hand when people started cutting lines.
Nagsimula po kami na maayos pong aming layunin, pati ng aming pagpaplano ng social distancing. Nagkataon lang po talaga na siguro gutom lang po talaga yung tao na kahit wala po sa pila, sumingit na po sila. Sa mga nagambala ko po dito, pasensya na po hindi po itong intensyon ko.
Many Filipinos believe that community pantries are put up out of necessity to help those in need during the pandemic. It's now a movement calling on government to respond better. Can Filipinos now expect better from government? We discuss in this episode of The Chiefs. Welcome to this special edition of The Chiefs. With me online is Luchi Cruz Valdez of News 5. Luchi, good evening.
Robbie, it's just the two of us tonight.
No.
But there's something big to talk about. No?
Oh, but you know, it's the big story of. I was just talking to Gretchen kanina when we wrapped up the big story. The whole story this entire week was really community pantries, di ba?
Yes,
and
absolutely.
In a way, medyo nakakagulat when you think back na, nga, no, isang linggo pa lang tong storyang to. Di ba? Parang,
and yet, nanganak na ng nanganak, no? At kung saan-saan na lumiko.
Oh.
And today was a major liko, no? In a way, no? When we saw what happened. And that's why we have our guest here tonight, my guest. Diba? I mean, that's the reason why she's here.
Idiretso na natin, di ba?
Yes.
Let's begin tonight with Mayor Joy Belmonte of Quezon City. Good evening, Mayor.
Good evening,
Good evening,
Mayor.
Robbie, and good evening, Luchi.
Mayor, let's start. I mean, inevitably, you know, we've always wanted to cover this as a feel-good story, but like Luchi said, there have been unexpected twists and turns, and also it's almost been like a roller coaster ride. Also some ups and downs. It's unfortunate that we opened this on a down, but what exactly happened in Barangay Holy Spirit kanina as far as the LGU is now able to piece together the details?
Well, as far as was told to me, philanthropist and actress Angel Locsin, who is from Quezon City, wanted to celebrate her birthday here with the community pantry. And she has a building in Barangay Holy Spirit with a grocery store. And I think she wanted members of the community to choose items from the grocery. You know, that's my understanding. But what she did was she posted a FB post last night, and where she talked about the community pantry and inviting everyone to come. But I think, you know, sometimes si Angel, siguro she doesn't realize the level of celebrity she stands for. She actually, her post had about 300,000 or more likes. You know, that means that had even more views. And when you invite people to come, obviously they feel they want to come. No? And I think what happened was Angel forgot to, well, it's not that she forgot, but maybe she felt that her team could already handle the arrival of the people and the crowds that would form. She did not coordinate with the barangay. She did not coordinate with the local government. She did not coordinate with the local police. No? And actually, that was, I think, the main problem. I don't like to blame Angel. I like Angel. She has a very good heart. She's a very good person. No? And nobody wanted what happened. But I think that the lack of planning and the poor coordination is probably the reason why crowds of people formed. And when the authorities, the government finally came on board, it was too late. There were just too many people. And maintaining social distancing or enforcing this became impossible. And it was really, really unfortunate that there was a 67-year-old man who had lined up since 2 a.m. to be part of this pantry, and he was already at the beginning of the line, meaning he had reached that far, and then he fainted, and we brought him, or the authorities, the barangay brought him to East Avenue Medical Center, where he was declared dead on arrival.
Yes, and unfortunately, Mayor, as you said, now we really do just have to ask some real questions. For example, you're very categorical. As you said, you don't want to blame, but you're just stating the facts. But you were, in stating the facts, you were very categorical. She did not coordinate with the city. She did not coordinate with the barangay even. Pero kanina po, kausap ko si Nery Colmenares, who happens to be a relative of Angel. Actually, pamangkin daw. I had to double check that. And sinabi ko na lang family member para hindi ma-distract yung viewers. But in any case, he was speaking for Angel, and he said they did coordinate with the barangay. I just want to double check that statement and what you said, and whether or not that can be aligned, and also dovetail that into a question of what does this do to the whole usapin about kung kailangan ng permit ng mga community pantry or not?
Well, una, Robbie, hindi talaga siya nag-coordinate sa barangay. I can say that, no? Because I know the way my barangays work. Robbie, come on, we're distributing 2.48 billion pesos to about 248 million individuals now through the ayuda system. We're talking about millions of pesos, billions of pesos being disbursed, thousands of people being organized every day. And yet we don't hear about any unruly crowds, about people dying, fainting, etc. Because we in government have already mastered the art of gathering people together, establishing social distancing, and getting the objective done. Okay, without with very minimal, if any, we're able to finish most of their ayuda with zero incident. So my task force discipline head, and he said, Mayor, I'm rushing na itatanghal or idadaos ngayon. No? So I'm going to go and help him. And this was early this morning. So my point lang naman is, like I said, perhaps the group of Angel, they felt they could handle the situation already without the intervention of the barangay, no? Because they did have stubs. They did, I think, distribute about a couple of hundred stubs, but then this was not enough to cover the thousands that had already crowded in the site. And I think that if they had coordinated one day before with us, we would be able to advise them how to go about organizing the people, how to distribute the stubs, how to make sure that those without stubs do not come out of the homes. We could have had our tanods, our various enforcement teams in place to maintain social distancing. So I can categorically tell you, Robbie, there was no coordination. If ever, perhaps there was a letter written, but there was no attempt to let's sit down and discuss how we can peacefully carry out this activity. But again, having said that, I charge it to probably just poor coordination and something that we have to improve on in the future. Now, I really don't like to blame Angel for this, because she's been a wonderful person and she has been working very closely with the local government.
Actually, that's what I wanted to ask you, because, community pantries just sprouted all over the place, and here in Quezon City on its own. It was very spontaneous, and I'm sure this was never part of any of your plans or projects, to set up stuff like this. And now that it's mushroomed, I'm just wondering what kind of monitoring or even additional coordinating and monitoring the LGU now has to do with all of these community pantries taking place all at the same time. And secondly, if you had known about Angel Locsin's project, and knowing that she is a star and people will probably flock because of her, not just her being a star, but the fact that she's known to actually undertake projects like this, in charity work since the start of the pandemic. How long would it probably have taken you to organize this to make sure that nothing like what happened today happened?
Alam mo, mabilis lang, Luchi, ha? We were able to organize ayuda, thousands and thousands of people going to 40 different sites per day, very, very peacefully one day before. That's how well we have managed to master this, because last year's
That's great.
ECQ was just so tough, but it really challenged us. Remember that last year's ECQ, we gave 4 batches of ayuda of 1 million per batch. So 4 million packed goods to families all over Quezon City. And yet we were able to do that because we have the proper organization, we have a system in place, and we know where these people live, and we know who are the poorest of the poor. And that's why this year it was very easy for us to do ayuda. We're almost 89% done.
Well, I know, but that's you giving out. But
Yeah.
in this case, it's many different people giving out in random places, and parang kunyari yan, would you have stopped her from doing it where she did it? Would you have first sat down with her to tell her, hey, you have 300,000 liking this post, so expect a really huge crowd, and so on and so forth. Kasi syempre iba rin yung iba kayo, yung LGU and the ayuda, and iba itong nangyayari dito, Mayor, di ba?
So, well, first, I want to separate angels from the rest of the
Yes.
community pantries, kasi magkaiba po yan. I have 130 community pantries now in Quezon City, okay? I had 70 the last time I was with Patricia in the show in another network. And then all of a sudden, dumaan pa within this week. And now, today, last count, 130. No, but ang una, with the community pantries, pinaikot ko lahat yan. No? After what happened to Patricia, and I vowed to her I would protect her, and I would protect the community pantry movement because of the great contributions it is making, and the spontaneity involved in this, where kind-hearted, generous, compassionate, and loving Christians, not even Christians, some are not, but just people, just coming out and doing their part for their fellow men. No? I wanted to protect that. No? And I started doing some guidelines already. In fact, pinaikot ko lahat ng mga community pantries, and I got, I tried to find out what was going on with them, etc. And so ibang issue yan. Actually, everything's fine with the other community pantries. Many of them are small. Many of them serve not more than 100 people at a time. They don't even coordinate. They don't even. What I require them now through these new guidelines I've just written down with my team and with Patricia and other pantry owners as consultants, pantry organizers. I just told them, I don't want to regulate you. I want you to self-regulate, no? But all I want is for you to inform your barangay, because at some point you will need your barangay. At some point people will crowd and you will need the tanods. At some point it'll get a little bit messy and dirty and you will need people to disinfect and to clean up. At some point people will not be maintaining social distancing and you will need enforcers to maintain social distancing for you. So please work with your barangays. Yan lang ang hiningi ko sa kanila. Walang permit, pero makipag-ugnayan kayo sa barangay ninyo, and think about various schemes, that to address certain issues that have arisen, no? Pero I do not regulate them. Kaya nakakatuwa, kanina dun sa public consultation may mga nagsabi, ginagawa namin bawal ang plastic para hindi mag-hoarding. O kaya binibigyan namin sila ng maliit na plastic lang. So kung ano man yung kasya dun sa plastic, yun ang bubuhatin nila, meron ganyan. O kaya yung iba may cut-off time. O kaya yung iba binibilang lang talaga yung pwede nilang tulungan sa bawat araw. So galing, because when you self-regulate, when you allow them to do that, they become creative and they can solve the problem, and they're mature and they know what has to be done. And there are just a few that have asked us to come in and bring in some enforcers to maintain social distancing. And I have a whole list of all of these 130 or so community pantries. And it's so far so good with them. In fact, the biggest of them is Patricia's in Maginhawa. And now we've just had a meeting with Patricia because there are some...
She's moving it, no?
Yeah, I'm moving it. Yeah, we're moving her to another location because it's becoming very big, the crowd, and some of the residents are getting a little bit apprehensive. And I called a meeting as the local government, I wouldn't, again, in the past, I wouldn't even interfere. But this time, I think I should, because there were some other stakeholders, some other constituents now that are voicing some, I wouldn't say complaints, no, but some issues. No? And Patricia very kindly and gently said, yes, we will work together, no? Just to make sure that, we just have to make sure that this movement continues. So ililipat natin si Patricia.
Mayor,
Now,
if you don't mind, I mean, we'll get back to this kasi naririnig ko naman talaga yung excitement and enthusiasm mo to support this community and this movement. But if you don't mind, kasi nga nabanggit nyo, this is for, you know, the community pantries na naiisip ng mga tao when they hear the name of Ana Patricia Non. But as you also said, kailangan natin ibukod yung mga taong katulad ni Angel Locsin. She has 8 million followers on Instagram. She's a public personality. In a way, people will have to say it's impossible that this was not anticipated. I mean, nearly 200,000 people liked her post. So does that create a demand for another set of guidelines? And when do you define when voluntarism crosses over into how we would officially define a public event?
well, first and foremost, yes, it requires a different set of guidelines. It requires, in fact, a meeting prior to the event, because Angel Locsin herself is an event. People, in fact, will come not for the pantry, but to see Angel Locsin. That's how popular Angel is. That's how loved she is. And maybe she didn't realize that people from Antipolo, from the provinces would come and line up at 1 a.m. because they just want to see their idol. Si Darna yan si Angel Locsin, di ba? Tapos may kasama pang ayuda. So can you just imagine, Angel plus ayuda, kung ang daming tao dyan. So, kung sana nag-coordinate kami ni Angel and her team at na-anticipate natin lahat yan, because these are things already in our checklist as government, na eto, sandali artista to, eto yung maaring dumalo, eto lang yung pwedeng ibigay na ayuda, hindi pala libo-libo, daan-daan lang. So we have this checklist, no? And I've done this before, si Robbie. That's why I know what this is about. I've done this because so many actors and actresses have worked with me, wanting to give to the community, wanting to share what they have, but they work with us first so that we can plan things out and iron things out first before they go down to the area, just because they know that their presence is itself an event. No? And I think...
Yeah,
Go ahead.
I'm just curious, no, because of this, red tagging issue that's come about, which started when, cops came to the Maginhawa community pantry and so on. I'm just wondering if LGU leaders like you are feeling some kind of dilemma or maybe wariness over whether you should regulate, or if not, how much should you allow them to just do their thing there without even a bit of regulation, para lang walang masabi na that you're intervening in any way, or either sumasawsaw or trying to keep them from doing what they want. I just wonder if you have to have a balancing act of that sort.
Actually, kasi Luchi, in fact, si Patricia, when she started, she needed some help with social distancing, etc. And the barangay was there to help her. I sent enforcers from the city, but I never personally visited her, just because I felt that this is such a pure, well-intentioned endeavor, and ayoko mahaluan ng kaepalan ng mga politiko. Because you know how people mistrust politicians. I've mentioned that to you before. And I want this to be a pure movement from the grassroots, from the people, from ordinary individuals who just want to help. No? Now, it also became clear after Patricia was red tagged that I have to protect my constituents from this as well. I want to be free. I want to keep them free. I want to, I want to distance myself from them. But when they're already, I think, maltreated by being red tagged for baselessly, I have to protect them. And that's why I spoke out. And it's really also because Patricia came out to me, reached out to me and said, Mayor, help me. No, and that's why I had to talk to the police. And then when we got to the bottom of things, it became clear that she was red tagged by the LCAC, which is not the Quezon City Police District. So in the beginning, there were thoughts that it was the Quezon City Police District. I met with the Quezon City Police District, the various station commanders. And then later on, si spokesperson Perlada admitted naman it was the LCAC, the NTF LCAC.
But how do you feel about allegations, no? Or sabihin na natin mga criticisms na this is nothing but a reflection of the fact that the ayuda is not only insufficient, but that it's coming so slow, and so on and so forth. How do you feel about those? I mean,
I've not even heard this from the community pantry organizers, by the way. The ones that I've talked to, they're just there because they see the need born out of a pandemic that has taken away jobs, that have made people hungry, something that is not unique to the Philippines, something that is happening globally. For example, something that has happened in the past, wherein there are, during the last recession, I know in the US, during times when there are crises like unemployment, people come together, people rise up and step up. And that's why we have community kitchens or soup kitchens or meal centers or, all these terms that just developed, which is basically the same thing. People coming together, volunteering their energies and their efforts and their resources to help people in need. And things like politics, this never cropped up in my conversations with these community pantry organizers. Now it became clear to me, though, that, I've been working with the LCAC as well. They are part of the local Peace and Order Council of the Quezon City government. I know that they have a task to do. They have a job to do, and that is to fight terrorism and the overthrowing of the government, basically. And we have been trained as mayors to look at the signs, no? And one thing that I find, something that I've mentioned already, in fact, several times, is that the LCAC should have trusted the local government because they trained us and even the barangays to look out for these signs. For example, what are these signs? Leaflets, demanding the ousting of the government or the overthrowing of the government, recruiting people, no? Having people sign petitions, for example, during the distribution of food, placards, words, certain types of words being told to the people, propaganda. But the reason nga why pinapaikot ko tong mga pantry na to is precisely kasi gusto ko malaman, meron bang mga ganun nangyayari? Because I feel naman na being a part of this government in general, the government in general, it's my duty also to tell the LCAC if I hear these things because they are part of my Peace and Order Council. And I've never heard these words being exchanged or these placards being posted or these recruitments happening. I've never. That's why I told out loud, no, I said, sana hindi na lang dinaan sa paghihingi ng personal na detalye. Sana hindi na lang nag-red tagging na hindi naman wala naman batayan. Sana tinanong lang yung barangay because we require naman na kailangan makipag-ugnayan sa barangay itong mga community pantries. At yung barangay, kilala nila lahat ng tao na nagtatayo ng pantry sa kanilang mga jurisdictions. Kaya the best person to ask is your barangay. And if you want to do some intel because you found out, maybe you have some intelligence and you want it validated, you ask your local government. No, because the local government can go around the city very discreetly and find out things that you want to validate. But what they did with their long arms, asking for details, I find that very, very disturbing. Not just for a mayor looking after her constituents, but in general. That I don't think that's the way things should be done.
Mayor, in the limited time, we do want to talk about COVID, the COVID situation in Quezon City. But I hope you don't mind. I'll segue to the larger COVID question, and you can answer that. But I want to go still take off from the Angel Locsin situation today, because with 10,000 people there, we saw the images of people in protocols being violated, the crowds there, many people, I imagine, crossing over from different cities. What is the fallout that you anticipate in terms of COVID, in terms of contact tracing, in terms of, if people could have been exposed, certainly contact tracing, one of the biggest issues. What fallout, if any, is already there, or are you anticipating? And from there, what's the situation in the rest of Quezon City? How does this complicate your work?
Well, this is, I wouldn't say 10,000 naman, Robbie. I think that's an exaggeration. I would say probably about 2,000. But yes, definitely, it's a super spreader event. If there is such a thing here of that nature, and people were really very close to one another. They were spending far too long a time together when they shouldn't. So yes, it's a super spreader event. In fact, earlier I had a talk with Secretary Duque about it, and he said, Joy, you just go and do some antigen testing randomly, because we have to find and detect these people who may have contracted COVID during this event. No, but he was very kind. He didn't blame anybody. He just said, go do your contact tracing, and that's what we're doing now together with my CESU. We're trying to the best of our ability, because maraming hindi taga Quezon City dyan, may taga probinsya pa nga na nandoon. Pero at least yung mga nandoon na taga community na kilala ni Kapitan na ma-identify niya na taga doon, we will have to conduct some form of contact tracing at the soonest possible time. In fact, we've started earlier today.
Just very briefly, how do you now address the issue of Quezon City still having the highest number of active cases of COVID?
Well,
doing something a little more drastic than usual, if you can. I mean, what are you doing to actively fight that?
Here in Quezon City, well, I always have to put things in context. As your co-hosts, well, your companions in the same network always tell me, Joy, put things in context. So we are, yes, the biggest city in Metro Manila with 25% of both land area and population. So yes, we are expected to always have the highest number of active cases. But the important thing is, are these cases growing or are they not? No? And as of OCTA Research's last report, which was given to us just today, and they are our consultants, well, our numbers are slowly going down. But of course, I'm not looking at this in a very positive light, because they tell me also that your numbers are very unstable, Joy. They keep changing. They go down, they go up, they go down, they go up. But the important thing is they don't spike. They're just kind of steady. And because of this, I have two main agenda now. Number one is to drastically increase testing and to find these cases at the soonest possible time and to isolate them. So by the end of the year, by the end of the month, April, I will have 3,200 quarantine or isolation beds, up from 2,000. So I will add another 1,200. And this is just in 2 weeks. And we have also multiplied our community testing sites. So we used to have 6, and by the end of the month, I will have 20. And
Wow.
you can book your
jump.
appointment, because we signed an agreement with the Red Cross to purchase a whole lot of PCR tests. Now that there's DOH guidelines for antigen tests, we also have thousands of antigen tests. I mean, we're just going to go out there and look for these cases and isolate them, and that's our strategy for the time being. And of course, we have lockdown areas, and they're still there, 45 of them. They're also very, very effective, and we have 2 new PCR tests coming in, just as donations from the Singaporean government, because now, because of the sheer number of cases during this surge, tests are coming in very late, and I want them to come much more quickly. So we're adding to the capacity of the city for testing as well.
Mayor, gusto ko lang balikan yung NTF LCAC. I'm curious, I mean, how exactly did you communicate with the NTF LCAC? Did they commit that they will stand down? And also, when you say that, very early on, you said we will protect not just Ana Patricia Noon, we will protect the community pantry movement. But as you also said, you also turn to the NTF LCAC and not only remind them to coordinate with you, but there's also inherent there reassurance to NTF LCAC na, we're doing our homework. Minamatyagan din namin kung may nagpa-pamphlet or may nag-ano. But, between that, I think meron ding mga tao who are asking.
Meron naman talaga.
Oh, but but there will also be people who will be asking the way we asked it with General Parlade, what's wrong with that? Kung maglagay ako ng karatula na nagko-community pantry ako kasi palpak ang gobyerno. Nagko-community pantry ako dahil Laos Duterte.
nagpo-propaganda,
So, that's still my right, di ba? Parang, do you draw the line? I mean, is that what we're saying when you say that we will protect the community pantries? Is there a line that certain community pantries, based on their politics, will be protected, and some pantries, based on their politics, will not?
You know, Robbie, simple lang naman yan para sa akin. Things are very simple. Tama lahat ng sinasabi mo. There is freedom of speech. You have the right to do this, to do that. But really, what good will it do in a situation such as ours? It will only divide us further. It will only take away the focus from the fact that our people are hungry, and we should just focus on feeding our people and making sure that they survive this crisis. Para sa akin kasi, tama ka, may mga karapatan ang mga tao, pero kung wala naman ikabubuting lalabas dyan, magiging victims pa sila ng red tagging, mas lalo pa silang pagsususpetsahan, mas matatakot pa yung mga tao nag-oorganisa ng pantry para maglabas ng tulong at mas maraming magugutom. Tingin ko, at the end of the day, kahit na sabihin mo na lang sa akin na hindi ka nagpa-promote ng or hindi mo pinaglalaban ng free speech, tama ka dyan. Sige, hindi ko na lang ipaglalaban yan, pero mas gusto ko na dumami ang pantry, they feel safe, and they're able to carry out the humanitarian task of feeding thousands of hungry people. For me, that is the more important task at hand at the moment.
Okay. Mayor Joy Belmonte, maraming salamat po for your time.
Thank you, Mayor.
Thank you.
Maraming salamat po.
Bye, Robbie.
Stay safe, ha?
Thank you.
And we need to take a break. Please stay with us. The Chiefs will be right back. Welcome back, the Chiefs. We're now in the final stage of our conversation. Now joining us is Professor Ranjit Rye and Father Nick Austriaco of the OCTA Research Group. Good evening, Father and Professor.
Good evening, Father and Professor. Father, you're still abroad, no?
I am, but
Yeah.
I will go home in 2 weeks. I finally was able to get the ticket.
And you've had your second dose, no?
Oh, I'm completely.
Moderna.
It's been a month, 2 months since my second dose, so I'm fully vaccinated already.
Yeah.
But
your antibodies have built up to a
97% protection according to Moderna.
wow.
Moderna. Okay, Father, let's start with the usual. Let's get the updates. We understand the reproduction rate is now below 1. Is there anything that needs to be contextualized there?
So we reported yesterday on a webcon, earlier today on a webcon, that the NCR, the R is now below 1. However, as we wanted to emphasize, and we will emphasize again, the current epidemic, the surge is still unstable. And one of the reasons why it's unstable is not every single LGU in the NCR is experiencing the same drop in cases. So the danger here is that some are dropping, but some will start spiking, and then eventually that one spike in one LGU will overflow to the next one. So it's wonderful news that the R for the entire region is 1, but not every LGU is consistently dropping. So we have to wait. Hopefully in the next few days, we will see, especially by the end of next week, when we are supposed to evaluate the MECQ, that you have a consistent across the board, all 17 LGUs are showing decreases. That would be the ideal. And then we would want the R to be sustained below 1 because, as you know, our primary goal at this point is to decongest our hospitals. And it will take several weeks of sustained R below 1 to decongest those hospitals because they are, some of them are, reports of the news is they're over 200% occupied already. And then yesterday, you know, Dr. Michael T., one of our colleagues, reported that 30 of the biggest hospitals in our capital are substantially full, 100% plus full.
Yeah.
Yeah. How many? Okay. How many weeks is several weeks? I ask because, of course, the MECQ is supposed to last until next week na lang, no? April 30, and people are watching to see whether it's going to be sustained or if it will be downgraded and so on. So how many weeks
our modeling,
are
we did some modeling to look at the decongestion, and basically the lower the R and the longer the R, the quicker it will take to decongest, right? So right now, if the R stays around 1, and Professor Guido's simulations are the daily cases would remain around 4,200 per day if the R remains at 1. What that would mean is that the number of cases would decrease to about 5 to, in the hospitals, the number of beds occupied would decrease to about 5,000, 5,500 by the middle of May towards the end of June. So they're going to decongest. The question is, how fast will the decongestion happen, and how dramatic will the drop be? So if you have 0.8, if the R drops to 0.8, it will decongest so that by the end of May, we will be at the levels at the beginning of the surge. So you see, it really depends upon how long we wait will correlate to how fast it will decongest and to what level it will decongest.
Professor Rye, you are the political scientist in the public affairs, public administration person in the group. Ironically, of course, every time the news is good and every time the numbers trend to something positive, that also raises the pressure on government, the public, the private sector, and even citizens to say, okay, pwede na ba? Pwede na ba? Do we open up now? How exactly how do we keep ourselves disciplined in the face of not even excitement but even desperation?
You know, it's tough, no, for everyone. This terrible surge is taking too long to normalize, no, and to go down. And to echo what Father is trying to say, it will be problematic for us to prematurely open. Okay, without the R going down to something like 0.8. The key problem is really our hospitals. They're all maxed out. And it's important for government to keep its eye on the ball, which is to try to slow this surge down and possibly reverse it. We're already in the midst of a possible downturn. Let's ensure that it becomes a solid trend. And just like the other experiences we've had before, when we work together, when we are patient, no, and when we focus on the objective, which is to bring down transmission, and cases tend to go down a few weeks after. And we're hoping that this is our models will eventually, the positive outcomes of our models will be realized. At 0.8, we're good. We're good. If we can keep that for a week or two, you'll see the difference. And we can, a few weeks more of discipline will mean more months open and more lives saved, and our hospital system, depressurized now from this very, very toxic situation that it's in. Yeah, it's really hard. In St. Luke's, for example, it's more than 100%. In all of the St. Luke's hospitals, and this is about premier hospitals. In PGH, it's full. So I mean, people are asking, calling me up. The last few days, asking if I know hospital directors, if I can help. It's hard. It's hard. So we need to be patient. It's gonna go down. We're there,
Yeah.
but we need to work harder to sustain it.
There are, to be sure, no, several factors that will actually be considered. And right now, of course, it's the critical care and hospital care facility that's a major factor in actually making it so, hard to beat at this point and even moving forward. Now, others will say, of course, that okay, we'll build isolation centers, quarantine facilities, etc., assuming that that can be done soon. Are we still going to have only MECQ as an option, especially considering that the other variable that we have to really point out is the fact that there are variants, that we're still dealing with the variants, and they're still very much here. And if we do loosen up, even after, say, 3 weeks, if the variants are still there, aren't we going to go the same path all over again and then declare another MECQ? Ganun na lang ba yun? Is it a vicious cycle, Father? I mean,
Well,
kasi nga may variants di ba?
I mean, yeah. So the ideal pandemic management scenario is that we will stay in MECQ to drop the numbers so that when we reopen, our contact tracing, our isolation, and quarantine capacity will be able to keep the residual caseloads at a low level, right? So our goal should be to drop those cases as low as possible. So when we reopen up, all the 25,000 DILG now sponsored contact tracers will be able to handle that. So there will not be a resurgence of the surge. So again, we need time to get that capacity in place because we know, working again with Mayor Joy Belmonte, that the DILG is going to be sending those contact tracers to Quezon City by the beginning of May. And it will take time to train, to get them going, to get them set up. So the longer we sustain the downward trend, will also give time to build up all this isolation. But more importantly, as Mayor Joy pointed out, if we can increase testing, if we have substantial more contact tracing, yes, those variants will attempt to grow. But the reasons why it surged so much is in many ways the variants were more transmissible than our capacity.
Yes.
But hopefully our capacity has been increased now such that we can now contain them.
Yeah.
We won't really know until we reopen.
Yeah, Father, speaking to the capacity, I hope you could explain this to me, and a lot of people have noted this. I think we're now standing at about 100,000 active cases, and it's remarkable, not only because it's a downward trend, but also because just a week ago, we were at around 200,000 active cases, diba? Highest ever. So our alarm at how quickly the active case load spiked is now also being met by a lot of confusion, if not skepticism, on how really drastic the drop to 100,000 is. Is that necessarily strange? And could you explain the science behind that?
So when you record a recovered case, so the question is, what is the criteria for a recovered case? So for here in the United States, for CDC guidelines, and I believe that the Philippines has just adopted this in the last few weeks, it's why you see significant numbers now recovering, is that in the past, the Philippines would require negative tests after you had tested positive to declare you recovered. And this was always a problem, even here in the US. So the US used a change to a symptom-based criteria where you have to be, it's been 10 days since you were either tested positive or onset of symptoms. The last 3 days, no fever, and every other symptom improving. Once you fulfill those criteria, you are declared recovered. So it's not surprising that when you change the criteria from a test-based one where there are people who test positive for 2 or 3 or 4 weeks. But now you are changing the criteria, which is scientifically supported criteria of symptom-based. What you're going to have is significant numbers of people declared recovered. So that's what you're seeing. That's why you're seeing a dramatic drop, because in many ways the criteria has made it easier for the national government to declare them recovered, but that those criteria are actually supported by the data.
So
But how is
in a
that
way, that's
useful?
also it can plainly be deduction that if you had reported and been recorded as in the data as positive, unless I'm sorry to put it this way, but unless you are reported to have died after a certain number of days, you are presumed to have recovered.
That's correct. So 10 days. So it has to be 10 days with the last 3 days no fever. Now,
Yeah, but how is that helpful? How is it helpful that you will declare somebody already recovered just on the basis of symptoms, even if science-based yung decision
well,
na
see,
yun?
from a public health perspective, recovered is no transmission. See, so the reason why we declare that is we have to figure out when you are safe enough to send you back out into the public. So the criteria that were established here in the United States, which is basically the basis for criteria throughout the world, is to say by 10 days with no symptoms the previous day, you are not transmitting anymore. So that's important for public health management, right? We can send you home. So and the reason why before it was you had to test twice negative is because we wanted to make sure you were not transmissible, you were not infectious. But now we know after 10 days you're not infectious, so that helps in pandemic management overall. It's not just people think it's shortcuts. No, it's not.
Professor.
Maganda yung numbers.
The numbers look better. No. It's actually, that's why there's basis in science, and that's why it makes sense.
Yeah, and I want to bring, again, Professor Rye into this, the science and the data. For example, when you take that the active caseload is now basically half of what it was last week, what should that then translate to in the barangays, in granular lockdowns, and what should we be seeing and expecting in our hospitals?
One thing's for sure, Robbie, the ECQ and the MECQ are slowly working. No, we are slowing down the surge. However, we are not yet where we're supposed to be as far as dealing with this surge is concerned. The primary problem, the primary argument has been, or the reality that we have to confront, is that we still have a significant number of new cases per day, something like over 4,000 cases. Number two, our hospitals are filled up. So these are the real challenges at the moment. And what we want to express as a team is that while we're seeing some positive, emerging positive trends, it's still too early. We cannot open prematurely, and that we all, given the reality that this is a shared responsibility, the argument we made in the webcon yesterday, that it's not just government, it's governance. So the private sector and the civil society all have to work together to bring this surge down. And right now, we are, in a sense, collectively succeeding. Okay, we hope that we can sustain this for the next 2, 3, or 4 weeks, and then we will see, Robbie, a sudden, more dramatic drop in active cases, and we will see our hospitals move from critical capacity, critical levels now to normal levels, and that's what we need as a basis to open up. And if that happens, we'll be open up for the next a few more months. Why? Because at the same time, June, July, Father, this is right, a bulk of our own second quarter vaccines are coming in.
Yes.
A significant number
I
is
was
coming
going to ask when will the vaccination be brought to bear on your projections, kumbaga? When will we feel the positive effects, kumbaga, of vaccination?
So there are two factors we have to consider for that. First of all, the global vaccine supply is severely limited because the Biden administration exercised options in the last few months to increase the capacity for the United States. So as of a few days ago, this is what I said on the webcon, as of a few days ago, every American adult now has access to a vaccine if he or she wants to. Anyone can get vaccinated in America tomorrow. So we are hoping that by July 4th, the Independence Day in the United States, that we will achieve herd immunity. However, it is striking the Biden administration has clearly pivoted away from herd immunity. We are not expected to achieve herd immunity because it became clear in the last week that not enough Americans will be vaccinated because they don't want to be vaccinated. So what will happen then is by the beginning of the third quarter, there will be such an excess of vaccines here that the United States will be able to release all of the vaccine reservations that it currently has. So the US has reserved 1.4 billion doses for 300 million people. So the Biden administration basically hoarded enough to vaccinate every American, both adult and child, twice. So once it's clear that the excess is substantial, they will release that. So what will happen then is there will be a large flood of vaccines entering the global supply. So the Philippines reservations will then be able to be filled, which is why you see that Secretary Galvez has predicted and forecasted himself, and I agree this is reasonable, that we will have millions of more doses in the third quarter. And so by then, we will start vaccinating. From the Israeli experience, it takes about 50% of a population to see an effect. And OCTA will be discussing shortly. Professor Guido and I have separately come up with models to reallocate those vaccines to particular regions of the Philippines to get that 50%, say in the NCR, done as fast as possible. Right? So the current strategy is spread out over the Philippines, and we're going to say that really you cannot do that if you want to do this as efficiently as possible.
Father, let me just recap that. Now, because of basically people not wanting to get vaccinated in the US, they have such a large base, they're not going to achieve herd immunity, which means that's at least 30% of their population not wanting the vaccine. So we're anticipating a flood of supply now available to the nations who want it.
Not even because of vaccine hesitancy. I mean, there will just be so many. There will just be so much that we.
Okay, now I just got curious. Bigla lang ako napag-isip sa sinabi nyo that the U.S. might not achieve herd immunity. We've been talking about herd immunity for the longest time. I always thought that was just the singular goal. Really serious question. What's the alternative to herd immunity?
So what will probably happen here? So, I believe that we will be able to achieve herd immunity in the Philippines because we are now seeing vaccine envy, which we have never seen here. So vaccine envy. Okay, so I don't know if you know, there's vaccine envy. So vaccine envy is, I see you have a vaccine, I don't have a vaccine, I really want a vaccine. So we don't see that here in the States. It's too deeply individualistic. But I can tell you, my research team at UST is already looking at vaccine envy on social media. So we can see.
Again, both of you, you do not anticipate any dissonance or gap between vaccine hesitancy here, which is because it's been reported, it's so huge, 6 out of 10 the Filipinos don't want. You don't anticipate a gap or dissonance between vaccine hesitancy and vaccine envy?
I think what's going to happen is one of two things will happen. One is we will be able to achieve herd immunity because of our collectivist mindset and vaccine envy. That will be one. And we will just be so tired of surges. We will be so tired. So that will be one. But number two, I think also in a way that is possible in the Philippines, not here, the government will begin to mandate vaccinations, right? So what will happen is the government will not even the government, but the private sector will start to require vaccination to go back to work. to go to school.
That's a whole other issue, though, Father. I mean, I can imagine.
Here, what's happening is the private sector is actually doing that. So we are having conversations in my university now. Will we require vaccines for students to return on campus in the fall? And it's looking more likely that we will do that. We will probably allow a conscientious objection only because that is mandatory in this country. But I think what you will see is that the private sector is going to want to require, especially where there are crowds gathered together, right? They're going to want to require vaccines. So you're going to see, we are having a new debate here that I'm involved in over vaccine passports.
Yes.
Now, you see in the
so
Filipinos will be happy to walk around with a QR code that says they've been vaccinated. This is not the case here. So we will enter this other conversation in about 6 months. You will see that we will have to have this conversation probably on the chiefs again about trying to figure out how to achieve herd immunity.
Father Austriaco, I assure you, we will not wait 6 months to bring you and Professor Rye and Dr. David
now
back.
that you brought it up.
We will see you next week. Unfortunately, we've run out of time. But thank you again, Father Austriaco and Professor.
Salamat,
Thank you.
Stay safe.
Okay.
Stay safe.
And that's all for this special edition of the Chiefs. We hope what was discussed here will keep the conversation going. Before we go, a reminder to everyone, mask on, wash hands, stay safe, Philippines. Ako po si Robbie Alampay.
And I'm Lucy Cruz Valdez, and we are One News.